Hi, everyone, and welcome to Beyond the Beam. And in today's episode, we're doing part two of episode one, which is cracking the code of laser physics. If you haven't listened to part one, then please go back and listen to part one, because otherwise, part two is not going to really flow that well for you. So in part one, we talked about difference between laser and IPL, and now we're going to delve into the actual light tissue interaction. So the first thing that's important is to understand the theory of selective photothermolysis. Now, it would be really good if you jump on our website and click on some of the clinical papers, and there's several clinical papers looking at the theory of selective photothermolysis, and it's great to have a good understanding. Initial work was done with the famous Dr. Rox Anderson, where he talks about this theory in great detail. So if you got the chance to read those papers, it's well worth reading these papers. So photothermolysis, it's Greek. Photo means light, thermo means heating, lysis means destruction. And if we translate that, we're using light to selectively heat an object, resulting in its destruction while preserving the surrounding tissue. So Roxanderson was the first one who said, okay, well, if we get these parameters right, if we select the right parameters with the right amount of delivery time, the right spot sizes, etc., we can maximize the clinical effect and minimize the risk of side effects. So the whole point of this theory was to maximize clinical results and minimize the risk of side effects. So when we want to when we want to perform hair removal, what the goal is destroy the root of the hair to stop the to destroy the germ cells, stop the hair growing. So what we do, we have to have a target, and we refer to that target as the chromophore. So the chromophore is the target that's going to absorb the light to produce the necessary effect. So if we're looking at, say, destroying hair removal, the germ cells are invisible. So we use the melanin in the root of the hair as the target chromophore. So we need to get light into that target chromophore to heat it up to a certain temperature to get a temperature rise to destroy the germ cells. Equally, if we're looking at destroying a blood vessel, then we want to destroy the wall of the vessel, but that's invisible to light. So our target chromophore becomes the blood in the center of that vessel. So we heat up the blood to a certain temperature to create this effect that we're looking for. So we need sufficient light to reach the target. The light gets absorbed by the target, which we refer to as a chromophore. The absorbed light converts to heat, and that temperature rise then is sufficient to provide the desired effect. So generally for hair removal, we look at raising the temperature 75 degrees. It would be the same for blood vessels. So we get that temperature rise, and then we got to keep it there long enough to create the clinical effect. Now, if we get the parameters right, we can, as we said, maximize the clinical effect and minimize the risk of side effects. So different treatments involve different targets, which we refer to as the chromophore. Different chromophores absorb different colors of light. So when we say looking at removing a blood vessel, we need light that's going to be highly absorbed in blood. So we're going to need our yellow or green wavelengths to be able to do that. If I'm looking to perform hair removal, then we need light that's going to be highly absorbed in melanin. So we would choose a red wavelength, and we'll come on to that in a minute. So different sizes of chromophore require different amounts of energy or heat to be delivered over different pulse durations. So depending on the size of the chromophore, depends on the amount of time we're going to deliver the energy over. And then these different parameters, the wavelength, the energy, pulse duration, will determine the type of device that we need to use to deliver these results. So the common target chromophores are for hair reduction. It's generally melanin, although when we use an Nd:Ag, we use a combination of melanin and targeting the blood supply, feeding the roots of the hair. For skin rejuvenation, it's generally water. Pigmented lesions is the melanin in the pigment itself. For vascular lesions, it's the blood. For tattoo removal, it's the various colors of ink. So for tattoo removal, you've got various colors. You can need various different wavelengths to create the effect. And for active acne, it's porphyrin. I am doing a lecture coming up soon on the treatment of acne because been some brilliant new breakthroughs. There's two breakthroughs, 1726, which targets sebum, which is a breakthrough, and then there's a 585 very short pulse laser, which has been used it targets a bit of porphyrin, but it creates an immune reaction within the system. There's some really good clinical studies we're going to look at, which have been published in the Lancet and British Journal of Dermatology. So look out for the episode on acne, and we're probably going to bring that forward sooner than we had planned because that's a really interesting topic. Now, if I want to blow up the black balloon, I can choose a wavelength that will pass through the white balloon without damage it. So if I get the wavelength right, so if you can imagine the outer balloon is the skin surface and the black balloon is the hair follicle, if I choose the right wavelength, I should be able to explode it without um, damaging without damaging the white balloon. So let me just play the video. So what you can see there is that the white balloon remains intact and the black balloon explodes. Explaining really the theory of selective photothermolysis. We had to have the right wavelength to create that effect. Okay, so what happens when light hits the skin? We're going to get a certain amount of light reflected. We're going to get some light transmitted. We're going to get some scattering and we're going to get some absorption. Okay, so these are the four effects that are going to take place. Nothing we can really do about transmitting. Some wavelengths transmit and will go through the tissue. Scattering, um, obviously, scattering can be quite useful because we need the beam to scatter to get a better coverage beneath the surface. So, but what we're really looking to do is maximize the absorption in the target chromophore. So how do we maximize the absorption in the target chromophore? By choosing the correct wavelength for number one, the correct spot size, etc. But the other thing that's often overlooked is make sure we reduce the risk of reflection. So how do we do that? So again, if you learn nothing from this episode today, then just remember this is the placement of the handpiece is important. So if you're using a handpiece, it would have to be 90 degrees to the tissue. If you start coming in your laser at an angle, you're going to lose a lot of reflection of light. In the same way as when you use an IPL, because we talked about with an IPL in the last section, you get this great scatter of light. To minimize that, you use the correct type of waveguide, but you also use a coupling gel. So in the past, people have thought of gel as being there with an IPL to protect the epidermis, but it's actually there to provide a bit of an optical coupling to get better, to reduce the amount of reflection of light. So what we need to do is prepare the skin. We're going to talk about that a little bit later. But if we prepare the skin and we use it in the right contact, with the right angle, we can minimize the amount of reflection, therefore increasing the amount of absorption, because it's the increase in absorption that's going to give us a temperature rise we're looking for. So the important parameters in order of importance, the wavelength determines the target, and also if we're looking at color absorbing wavelengths, like we talked in the last episode, will determine the depth we're going to go to as well. And then we need to get the selectivity of the target, right? And we do that by pulse duration. Okay, pulse duration is critical. We'll come on to it in a minute. And then we got to make sure we have the correct spot size, because spot size also has an impact on depth of penetration as well. Then we've got to make sure we have sufficient energy to get us to temperature. And we've got to make sure we get the cooling right. So that's making sure we get the right amount of pre-cooling, the right amount of post-cooling. We've got a mini episode where we'll be looking at cooling and the effects of cooling and different ways to cool. Yeah. So if we get all these parameters right, we can create the effect that Dr. Rox Anderson talks about. We can minimize the risk of side effects and maximize the clinical output, and that's what we're looking for. Okay. So we know that different wavelengths go to different depths. We talked about this in episode one. So an end a 532 KTP laser is quite superficial. Yellow will go a bit deeper. Ruby will go a bit deeper. Alexandrite then a little bit deeper. diode at 810 a bit deeper, and then the Nd:YAG is one of the longest. It's got the biggest depth of penetration when we're looking at color absorbing wavelengths. And then water absorbing wavelengths, remember, we change the depth by, you can change it slightly by the spot size, but you change it by the amount of energy you're going to use generally. And we have got an episode specifically looking at water absorbing lasers as well. So now we need to understand this graph in more detail. So we look at the effect of wavelength and target chromophores. So when we look at this graph, this on this side here, you got from 1 to 1,000, and this is the absorption coefficient, how much something is absorbed. So how much something is absorbed times the energy gets us to a temperature. Okay, so and along the bottom then we have the wavelength. So, and then we have three lines. So we have the absorption in blood is highlighted by the red curve. The green curve highlights the absorption of light in melanin, and the blue the absorption of light in water. And we're looking at here wavelengths from 400, and we constant up to around 40, showing up to 1400 nanometers. Okay, but we're looking at 1200 nanometers. So what we've learned already is that when we look at light from 400 to 1200 nanometers, a color absorbing wavelength, the longer the wavelength, the deeper the light will go. So these wavelengths here on this side are going to go deeper, and these ones are more superficial. So when we look at removing a blood vessel, say, we need the absorption in blood to be much higher than the absorption in melanin. So if we look at this curve here, if I draw a line from the peak here, which is about 440 nanometers, and we drew a line across, that would have an absorption coefficient of around about 8,000. Okay. Where we look at the absorption in melanin, it's only around 400. Okay. So we can say that a 440 nanometer, if there was a 440 nanometer laser in existence, it would be 20 times more absorbed in blood than it would be in melanin. Okay. Therefore, on paper, that would seem like a really good wavelength to be able to use for blood vessels. But the problem we got is blue light doesn't penetrate deep enough because it's so superficial. So we need to look at longer wavelengths. So now what we need to do is look at the next curves. So what we generally use, we use the KTP green lasers and we use yellow lasers for absorption in superficial capillaries because the absorption of blood is higher than the absorption in melanin. Now, if you look at 532, there is a difference. It's higher absorption of blood than it is in melanin. But depending on how you configure the laser, you can also get it used for melanin because generally for pigmentation, you have shorter pulse durations. Okay? So you can manipulate, or as I said, you can put pressure on and you can sort of try and take some of the blood away by putting pressure on, where you can change it. So a 532 laser is quite good, useful for superficial pigmentation and superficial capillaries. So green and yellow we'd use for these. But then when we look at things like, if I want to then remove things, if I want to perform things like hair removal, okay, I need a wavelength of light that'll go deep enough. So now we got to look at these longer wavelengths here, but is also preferentially absorbed in melanin. And we see that with our ruby lasers, the Alexandra, the diodes, okay, and then so these are all ones that are useful for hair removal because the preferential absorption is melanin rather than blood. Now, when you look at the Nd:YAG, you can see there's an absorption coefficient of around 10 in blood and 20 in melanin. Okay, so it is higher absorbed in melanin, but the absorption is so low in melanin that this laser becomes a really safe laser to use on darker skin types. Much lower absorption than the lasers here. Okay, so the Nd:YAG is a useful laser because it's got much lower absorption in melanin, which means it's much safer for darker skin types. So people often struggle with this. So remember, it's the coefficient multiplied by the energy when we look at will get us to temperature. So I can still, because this will go deep, I can still use this wavelength to perform hair removal on darker skin types, although it's got a lower coefficient. Okay, only around about 20. Okay. If I put the energy high enough, I can get the temperature to rise. It's just about getting your coefficient with your energy right will get us the right temperature. But because of the lower absorption level, it becomes safer for darker skin types. But what I love about the Nd:YAG, it also goes deep. So it becomes really great when you start looking at things like leg veins, because there's a wavelength that'll penetrate deep enough to do leg veins. And if you've got the right type of Nd:YAG, you can start removing veins of up to 4 millimeter in diameter. So you can do the blue veins. So it's a useful wavelength to be able to do. We have got a whole vascular course coming up. It's one of the webinars we're looking at. We run a level 5 vascular course as well. So look out for those webinars and courses. Now, when you start, and if I were to say, if I was say performing hair removal with an Nd:YAG, you can see it's also starting to get absorption in water. So because it gets absorption in water, you find it'll start to stimulate collagen at the same time. So it's one of the benefits of using it. So we have to have the correct wavelength. So typically, if I was to, in a nutshell, blue light's got really superficial absorption, but it's got high absorption in porphyrin. So blue, green, and yellow, or a combination of them, we often use for traditionally for using acne. I've told you there's new ways to do it now, and we're going to come on to that in another webinar. So typically, blue light for acne, green light we use for superficial capillaries and superficial pigmentation, yellow light for superficial capillaries. We use the ruby and the alexandrite can also be used for superficial melanin, but traditionally we use these wavelengths for hair removal on lighter skin types. Diode laser, because you can run it at a very long pulse duration. We've covered why diode laser is different. You can also use it on all skin types. The Nd:YAG at 1064, you can use on all skin types, whether that's for hair removal or for vascular work. It's an efficient tool. So, as I said, typically blue light for active acne, green and yellow also work. Green light for superficial vascular lesions and pigmentation or lighter skin types. Red can also be used. Yellow light for vascular lesions, red and near infrared for hair removal, and far infrared light for stimulation of collagen. So when we go over 1200 nanometers, can you see what's happening? The water absorption takes over. So because of the water absorption takes over, we start to now change to be able to get this high absorption in water, which allows us to stimulate collagen. So once we get the wavelength right, the next most important thing is to get the pulse duration right. So the pulse duration is our energy that's going to get us the temperature, but it's the pulse duration that'll keep it there long enough to get that transfer of heat to produce the clinical effect that we're looking for. We know shorter pulse durations are more aggressive, longer ones are more gentle, but we have to get this pulse duration right. So I want to talk a little bit about cooking meat. Okay. So if I cook a beef burger, I go to my oven and set my oven to maybe 180 degrees C, and I cook my beef burger in about 15 minutes. When I want to cook a joint of beef, I still set my oven to 180 degrees, but now I cook it for around 2 or 3 hours. I've adjusted the cooking time to the size of the meat, and it's the biggest mistake that people make when they start doing laser treatments. They don't adjust the pulse duration. They don't get the pulse duration right. The pulse duration is critical for getting the results. So you have to match the pulse duration to a thing called the thermal relaxation time. Now, when you download the paper by Dr. Rox Anderson, there's another one by a really good friend of mine and a great guy, Mike Murphy, and he talks about the thermal relaxation time. Okay, so he also talks about the thermal relaxation time. So it's really important that we get the pulse duration correct. A pint of water will come to the boil quicker than a gallon of water. So the pulse duration becomes critical. If anyone's been on one of my advanced um, level 5 vascular courses, when we start looking at leg veins, we're going to use an Nd:YAG. We typically always use about 120 joules per centimeter squared with a 7 millimeter spot size. We start off by sealing the bigger feeder vessel with a 50 millisecond pulse duration. And you notice I don't really alter the energy. I just make the pulse duration shorter and shorter until the vein disappears. Remember, everything should be done in a controlled test back procedure. Yeah. So typically when we want to stimulate um, the microvascular network, we would look at pulse durations from, around about um, zero point 0.3 milliseconds or 300 microseconds up to about 5 milliseconds. Fine telangiectasia, fine hair, 3 to sort of, I would say, 10 milliseconds. Medium, 10 to 30 milliseconds. And then when we start to go in coarse hair, 30 to 60 milliseconds. And leg veins, again, I typically use 30 to 50 milliseconds. We talked about spot size and is it an issue? Yes, spot size is. The bigger the spot size, the deeper the light will penetrate. Okay. Unless you're looking at, and we're referring here to water absorbing, we're referring here to color absorbing wavelengths. When we look at water absorbing wavelengths, um, actually the smaller the spot size, the deeper they can go, but it depends really on the energy as well then, okay? So when we're looking at color absorbing wavelengths, the bigger the spot size, the deeper the light will penetrate. Now, also, the bigger the spot size, the more efficient it becomes. So the bigger the spot size, the less reflection of light you get. So if I'm treating someone and I do my test patch procedure, say on a 5 millimeter spot, but I decide to use a 10, okay? There's a very different clinical effect because a 10 millimeter gets less reflection of light, so there's more absorption in the target chromophore. So a bigger the spot size, the less energy you need to create the same effect. Typically, um, I threw this in because just to remind people, if you're going to use an Nd:YAG on superficial veins, particularly on the face, then don't be using a spot size bigger than 3 millimeter. Otherwise, you go over that and the Nd:YAG's in a penetrate too deeply and you'll end up with indentations. Typically for leg veins, my go-to is 7 millimeter. Sometimes I'd use 8 millimeter. I wanted to throw this in. It's something that's new to the course, but I was asked to give a review of a patient that had a burn, okay? And we were trying to look at the different things that happened. So we put this paper together, which is called The Effect of Spot Size Error on Delivered Energy Density. So a client approached us to say that, look, they've had this burn, they don't understand what's gone wrong. Um, so this give you the backstory. The client had about 8 treatments and 7 or 8 treatments, and this was the next treatment, okay? And the energy settings they used were really similar. Um, but actually, what had happened, because they created a burn, a company went in then to calibrate the machine. And what they actually showed is that the machine, instead of it being 10 millimeter spot, was actually only 8 millimeter. There was a calibration error on the machine. So whilst the machine, you touched the screen and it said it was 10 millimeter, the measured beam was only 8 millimeter. And if you read this paper, which is very scientific, okay, this leads to a 56% increase in delivered energy. So while if the machine was at 40 joules per centimeter squared, instead of being 40, it was a 62 and a half, it was 62 and a half joules per centimeter squared. If it was 50, it was 78.1. So it was a 56.3 increase in energy because of an error in spot size. So it's really important to make sure you get your, measure it. So if now this has taught me if I'm using a laser, I'd fire in a bit of photographic paper to make sure that spot size is correct. Okay. I don't know for sure whether that created the burn, but it's certainly a 56% increase rise in energy would be a contributory factor. So make sure the spot size is correct that you're delivering. Yeah. When we come on to the absorption of lasers in water, so we know that below 2000 lasers are non-ablative, above 2000 ablative, and in a few slides' time, we're going to talk about sub-ablative laser, and particularly the 1927 nanometer, and why this is a unique wavelength. So when we look at non-ablative, we're looking at maybe 1064, we can microsecond pulsar, then we can use fractionated 1320, 1540, 1550, 1565, and then we come on to, we'll talk about 1927 fractionated lasers. Okay, so we know that these wavelengths, they are below 2000, so they don't cut tissue. We know they're highly absorbed in water. So what they do, they create these columns of heat. So if we can raise the temperature by creating these columns of heat that will allow us to stimulate fibroblast activity and start to repair the tissue. Okay, the whole point of fractionating a beam is to take a full beam and break it up into many more microbeams. And the first guy who invented that, it was a major breakthrough because CO2 lasers, you take off layers of the skin, you'd get a fabulous result, but you'd be looking at weeks and weeks of downtime. So what they're able to do by fractionating the beam is maybe do 2 or 3 treatments, but get a result which is as good as a fully ablative laser, but with much quicker recovery times. And depends, how aggressive you do, but it could be several days to maybe a week. Okay. So we know that we control depth of penetration by the energy. There is a slight difference when we particularly look at the CO2, where the smaller the spots are, the deeper it'll go, but it's still controlled by the energy. So in this particular machine that I was using in the past, the 1565, 15 millijoules will take us to 400 microns. 100 millijoules will take us to 1100 microns. So the higher the energy, the deeper the light will go. So how do you control the intensity? You control the intensity by the number of microbeams. So typically with this particular device in the past, if I was treating pigmentation, I need a lot of microbeams, but low energy. But if I want to go deep into a wrinkle or scar, I need a lower number of microbeams and more energy. So you've got to work your energy out at the correct depth. That's about understanding your machine. If you're looking at CO2 lasers, we have a great course online where we look at the exact depth of penetration of CO2 lasers. We can look at the spot size and look at the number of times you fire it to get to the exact depth. Okay, we've got another whole mini webinar coming up where we're going to be talking about that. So in generally, high number of microbeams with low energy if you want to treat very superficially and things like pigmentation. But when you want to start doing wrinkles and scarring, you need higher energy and a lower number of microbeams. And then you change your shape depending what you're treating. I quite like a square for covering the whole area. But if I'm doing a small little acne scar, I choose a circle. I would maybe use a rectangle if I'm going deep into wrinkles. So you can choose your shape accordingly. And that's what's exciting about, fractionated lasers that are delivered via this mirrored system, by this motorized system or a scanner system for delivering the energy. So what is 1927? Why it's different? 1927 nanometer is the highest wavelength available that's non-ablative. Okay. So it's not ablative, it's not non-ablative, it's sub-ablative, okay? And sub-ablative is really different. And sub-ablative is exciting because what sub-ablative does, it creates these zones of ablation beneath the stratum cornea. So when you fire the laser, this high absorption in the water creates these zones of ablation just beneath the stratum cornea. Okay, but during this time, steam bubbles rise and create these tiny channels in the tissue. Okay, now whilst that's firing, you also get this second area. This is a coagulation zone. So now you can coagulate an area for stimulating collagen. New paper that's just been published talks about the depth of penetration being 500 microns. If you increase the energy and intensity, then this zone is going to be bigger. So what it allows you to do is create this zone of ablation and create this zone of heating to stimulate collagen. The zone of ablation is important because what it allows you to do, as I said, is get these pockets. And if you compare it to every other wavelength, they can't do that. You can't do that with a non-ablative 1550 or 1565. A CO2 laser creates a channel. A 2940 creates a channel. It's just the only one that allows us to have this pocket. And the pocket's important because it allows us then to start delivering a drug into the tissue. So we can select different products, maybe like tranexamic acid, vitamin C, vitamin A. And what it allows us to be able to do is deliver higher doses of that cosmeceutical or drug into the tissue. I think there's an episode coming up where there's an episode, a third episode, where I'm talking about this type of laser and the technology behind it. Okay. And then I'm going to talk about hair restoration. So there's what this allows you to do is get the ultimate combination to get the effect of a laser, but then mix it to increase the intensity of a delivery of a drug. We know that for melasma, tranexamic acid would be the choice of product that you would use, and you probably do 15, 16 treatments. But you can do after 3 treatments, you can see here on a bit of melasma pigmentation using probably um, tranexamic acid, okay, or maybe vitamin C. But you can see a brilliant before and after photograph. This is a lady I do a lot of work with in the UK, Chantal. She just sent me this photograph, and this is where she's using vitamin A to stimulate collagen. But you can see how the appearance of the skin is improved and the wrinkles are softened. And that's by the combination of the effect of the laser, but also that we can increase the amount of delivery of a product that we put into the tissue. These channels stay open for about 48 hours, and the person keeps applying this. So look out for the next episode where I'm going to be talking about particularly this type of laser because it's an exciting breakthrough. It's something that was new to me, and it's something I think is really exciting. Okay. When we perform treatments, it's really important to prepare the tissue. What's the difference here? If I'm looking out to this car with a dirty windscreen, there's no light coming in. But if I wash it with the windscreen wiper on, suddenly the light comes in. Most people don't think about preparing the tissue. It's really important to prepare the tissue. Future episodes we're looking at we're going to look at different ways to prepare the tissue. But lots of people would maybe do a chemical peel a few days before, or on the day of treatment, a slight fluid acid peel. Remember, the smoother we can get the surface, the much more energy we can get in absorption. So if we can reduce the amount of reflection, we increase the amount of absorption. And that's really important to get that right before you start a treatment. So, in a future episode, we'll talk in depth about different treatments. We look at different treatment results, and we'll do an overview of different lasers and what we can use them for. But based on my experience for hair removal, I've used an IPL, I've used an Nd:YAG, I've used a diode, and an alexandrite. But your best is to get a combination. If you're going to use an IPL, then you need an Nd:YAG with it. If you're going to use an alexandrite, you'd use an Nd:YAG. I'm a fan if you got the right budget and Alex and Yag, I think it's the perfect combination. If you get a high powered Yag, then you can also use that for other applications like leg veins as well. For vascular lesions, if I'm going to use an IPL, it would have to be an IPL that's got notch filter technology because I think that's a game changer. My favorite for superficial capillaries is a 532 laser. I think they work really well. Okay. Pulsed dye lasers were brilliant in their day, but there's too much risk of bruising with them. And I also have a fan of Nd:YAG. And if you're going to treat leg veins, then it's an Nd:YAG that you're going to need because it's the only one that's really effective for deep leg veins. And a good quality Nd:YAG will allow you to do leg veins up to 4 millimeter. Um, for pigmentation, there's multiple ways to treat. Okay, you can use a Q-switched YAG, you can use a 532 laser and a 755 laser on lighter skin types. You can use an IPL on lighter skin types. Okay, and then you can use a picosecond device. And picosecond device or Q-switched nano and picosecond devices allow you to treat all skin types of pigmentation. One of my new favorites is the 1927 nanometer fraction laser. We use laser MD on our courses from Neutronic. I think for me, that's one of the most exciting lasers because now you can read all skin types all the year round for melasma and pigmentation because you can use a drug to really help to enhance that result. So for me, my first choice for pigmentation these days would be 1927 nanometer. I have people that phone me and say, Kevin, I'm looking at which pico machine should I buy? My first question is, are you doing tattoo removal? No. Okay. Well, what are you looking to do pigmentation? For sure, I would choose a 1927 now. Okay. That's my preference. For tattoo removal, it depends on, are you wanting to do all colors of tattoo? Are you looking to treat professional tattoos? Are you just looking to do some amateur tattoos, in which case you can probably get away with a cheaper, mediocre type of nanosecond device, okay? But if you want the best results on tattoo removal, then you combine nano and pico devices with multiple wavelengths of 4 wavelengths are often the best way to go. Tattoo removal depends really much on your budget because you can have machines from really cheap prices into the £180,000 worth of equipment. Collagen stimulation. Those who know me, I'm a massive fan of CO2 laser. I think they work really well. So you can use various fractional ablative and non-ablative lasers. You can look out for an episode where we're going to be talking about microsecond pulsed Nd:YAG. That's where you create a shock in the microcapillaries to stimulate the body into thinking it's been injured. That's a really cool way to treat. And I also, as you said, I'm sounding like a broken record. I really like the 1927 nanometer fractured endothelium laser. I think that works. That's a really good option as well for collagen stimulation. Look out for our episodes on combination therapy because I believe combination therapy is the way forward. We've got an exciting episode which is booked in um, where we're looking at using a CO2 laser combined with the Thelium 1927 nanometer. And what the 1927 does, it allows you to deliver drugs to enhance the result, but it allows you to speed up the recovery time as well. Okay, so this is based on my experience. I'm sure other people have different experiences. I hope you enjoyed the first episode, part one and part two. Look out for questions with Kevin, which is going to be co-hosted with Sophie Rodriguez. You can see her email address there, sophie.rodriguez at cerebrum.com. Okay. If you email Sophie, questions you have on the first two episodes, we'll answer them during question time. So the idea is we'll put one and two episodes out, and then the few days before the next up and coming episode, we'll have this question time. So, and I say during question, we'll discuss the previous Beyond This Beam episodes, and we'll answer any questions, and we'll discuss the next up and coming episodes. So please, if you got any questions on anything, send them to Sophie. We can't run question time without questions, so we look forward to receiving your questions. So again, big thank you to Cerebrum 360. Without Cerebrum's support, we wouldn't be able to do these webinars. Future episodes may change slightly because I think we've changed it slightly now, but certainly the next episode we're going to be talking about sub-ablative lasers, and then we want to go on some combination therapy, and we've got a whole host of things coming out. Follow us. You can follow me on Instagram, hashtag Kevin Mrs. Expert, or you can follow Cerebrum UK, Cerebrum France, the Cerebrum Group, or you can go on the Cerebrum website to find out more. Uh, Thank you for listening, and I look forward to seeing you next time for the next episode of Beyond the Beam.